As the world comes back together, I think for a lot of industries, COVID does seem far in the rearview mirror, but for healthcare, it still is part of the daily experience.
The saddest line I hear in healthcare today, and I still hear it more than I want, is, well, we've always done it this way. Data, data, data. There is more of it in healthcare than any other industry because the solutions are there. They are not out of reach, they're not impossible, and they're not things that we can't afford.
Welcome back to Talent Hunters, where we explore insights and trends shaping the global recruiting and staffing industry. Want to build talented teams that drive your company toward big goals and big growth? Then this podcast is for you. And now, let's join the conversation with today's episode of Talent Hunters, brought to you by HireQuest. Connect with us at hirequest.com.
Ladies and gentlemen, my name is Vince Holt, the host of Talent Hunters. And today we have John Dursey, a senior leader with Mercer's healthcare provider industry practice, and Will Self, the global leader of Mercer's workforce strategy and analytics. Welcome, gentlemen.
Thank you.
Thanks for having us, Vince.
Looking forward to this. So, John, could you please describe what Mercer does and what specifically your mission is today?
Sure. And I'm going to ask Will to weigh in too, because I could go on for a long time, and I'm going to keep it fairly precise if I could. But Mercer is a consulting firm. It's the largest consulting firm in our space, which is a focus on human capital, on people and organization. But also, we have a very large part of our business that's focused on investment management, asset advising. But Will and I really represent the consulting side. And again, our focus is on industries, on specific challenges and needs within the human capital space. Good way to describe this, Vince, is as organizations focus on performance, as organizations focus on changing strategy. We think about what are the different kinds of capital that organizations deploy in order to deliver on their promises to customers or to beat competition. There's financial capital, there's operating capital, and there's human capital. Our job is to connect the dots, to position our clients for the most effective human capital management, building, strategy, performance, all of that. And when we think about healthcare, the beauty of an industry focus in an industry that is so disrupted and changing so dramatically is that we're able to organize our subject matter expertise and our experience around those client challenges specifically in terms of workforce shortages, in terms of burnout, performance, all of the things that we'll, I'm sure, touch upon in our discussion this morning. But think of us, Will and I, as the needed components around human capital, both change and then as well as performance. Will, anything you want to add to that?
No, I loved how you phrased that. I mean, the reality is that for most organizations, the people make up the largest sort of expense line item for the company. And part of our job is thinking about how do you use those people assets to the best of your possibility as an employer. But also, how do you create environments where people are going to thrive and they want to work together, they want to work for you, they want to do what's best for your customers or clients, and really, show up in a way that helps organizations grow.
So we're seeing so much happen. I mean, good Lord, in the healthcare world, we have COVID 5 years ago. And that just turned the world into a cyclone, really. And as we come out of that, now we've got so many layoffs handling all over the country with so many healthcare providers and so forth. And either one of you can answer this to the best of your ability. What can we do to start to get a handle on this?
That's a great question. Will, why don't I start? And then I know you're going to follow on some specific points. But Vince, let me just react to the COVID comment, because I would argue we're not out of it from a standpoint of the healthcare workforce. This is a part of the world that was so impacted and damaged as a result of this incredible pandemic and what they went through. And things changed to where we are today. I view this workforce as still recovering. Well-being has never been more important to the organizations that we work with, healthcare providers, hospitals, health systems, and everything in between. It is all about what do we need to do to keep track of our workforce and how they're managing what is still a stressful and chaotic work environment. We'll have some stats I think we can share in a little while that you'll find interesting. But I think that this is serious business, talking about the well-being, both mental and physical, but also now we're dealing with safety more than we ever have. And this is safety about violence I consider to be unacceptable, meaning patient-on-worker violence. And I think this is never anywhere near where it was before COVID to where it is today. Something like a switch was flipped or something, Vince, where all of a sudden what was unacceptable becomes more common. And this is a big issue related to this workforce. So still recovering, organizations are focusing very much on the well-being, physical and mental, but we have a ways to go. There are still lots of gaps to close. And again, I'm going to hand this to Will, because so much of these decisions and strategies can be driven by the data. It's right there. It's telling us what's wrong and what do we need from the diversity of this incredible workforce, 5 generations in the healthcare workforce today, and where they are. So, Will, maybe over to you to pick up on that thought.
Yeah, I think just the way Vince opened this up, it's kind of shakes your mind a little bit about how much change we've thrown at healthcare over the last few years. I mean, to think that we're 5 years post the onset of COVID, which makes me feel old. I don't know if anybody else is having that reaction. It feels like it was yesterday. But as the world kind of comes back together, I think for a lot of industries, COVID does seem far in the rearview mirror. But for healthcare, it still is part of the daily experience. There's the people side of that, right? An incredible number of healthcare providers left the industry during COVID, right? They decided that was the final straw, that they just couldn't do this anymore. And we saw real exodus of key roles and a lot of talent from healthcare in 2020, 2021, 2022. Fortunately, that's stabilizing a bit. We're just not seeing that run from healthcare that we were seeing for a while. But I think it would be naive not to acknowledge the human toll that left on the people who stayed. I think we have healthcare providers who have some degree of PTSD from COVID that they're still sort of wrestling with. The kind of hours, the intensity, the stress, it all just went up a level during COVID. And for a lot of healthcare providers, I'm not sure that ever came back down. And so that's just a real part of anybody who's interacting in this space. The other side that I don't think we talk enough about, though, is the financial impact of COVID on the healthcare industry, right? If you remember back in the 2010s, everything healthcare providers were talking about at the time was about improving margins in healthcare. And honestly, like hospital systems did some amazing work to cut costs, to get more disciplined, to bring in productivity enhancing technology. And I would say by like 2019, we were probably looking at some of the healthiest financials that we had seen in a long time in the healthcare space. Then COVID hit. And it's like people just received blank checks, and the spending has just been incredible over the last few years. We have some research from within the MMC family that suggests for the average hospital system, they would have to remove about 20% of their costs today just to get back to the pre-COVID margins that they were looking at. I mean, that's a huge number to think about from a cost reduction standpoint. And because healthcare is so labor intensive, right? When we talk about healthcare, we're really talking about people touching patients, right? So when you talk about reducing 20% of costs, these are not theoretical costs floating around. These are human beings who are in the front lines providing services. And so this is not an easy math to make work as you're thinking about the future. But that's kind of the place that we're all in when we're talking about the healthcare industry.
You know, what's interesting is I just had a conversation with a couple of people in the medical field. And we started to get into a deep dive, and I want to cover this with you folks too, is it appears that we have kind of a dilemma going on in the healthcare world where there was there was a time everybody wanted to be a doctor or a nurse. And there was something about that that was driving people to it. COVID hit, and you both brought it up, costs have gone up. But what I find is we're not getting as many doctors and nurses like we used to, but we're burning them out. And I'm hearing more and more about doctors and nurses done. I mean, they want a life. I mean, you hear people in the other part of the working world talk about work-life balance. No such thing with doctors and nurses. And so what's your take? And let's break it into two categories. Let's talk doctors and let's talk nurses. Either one of you, please make comments. Let's take doctors first. What's happening out there in your eyes?
Will, yeah,
Mind
you
if I
jump in first.
John?
I'm going to follow you this time.
Okay. So I think you just nailed this dynamic, right? I mean, at the same time, I mean, yes, everybody, developed an outward appreciation for frontline workers during COVID, and some of that I think has lasted since then. But I think COVID just really unveiled some of the less attractive sides of healthcare, right? The intensity, the hardworking conditions, the physical and health safety, risks that might be there for frontline workers, especially in a world where it's now not science fiction to imagine a global pandemic hitting, right? And so I think one of the things that especially physicians have woken up and noticed, and this isn't the first time they've done this in history, right? It comes in cycles, but they realize there are other career options that value their medical training, that don't cause them to fully pivot from the industry. So, we have clients who are law firms or pay equity or private equity firms or investment banks or, other types of professional services that have entire practices based around either working with doctors or medicine or the healthcare industry. And they would love to have physicians who are crossing over and working in that space, who just understand the industry better, have deeper technical expertise. And so, we've helped clients source talent from healthcare to come over into non-healthcare worlds. It's definitely part of the world. And I know a lot of physicians, are thinking about that a lot, how their skills might be more portable in the industry. I think the other thing to remember is that, we still see growth across all roles in healthcare, right? I mean, sometimes it feels, there are scarcities, there are shortages, but the raw numbers of people who are actually in these roles are growing year after year after year. But the flip side is that the world is aging. The United States is aging. And with an aging population, you just see this incredible growth in healthcare demand year over year. And so no matter how many people you have signing up to be doctors, you always need more, right? There's more and more patients lining up who need doctors. And so, we've talked about physician shortages for a really long time. I mean, I think that's still part of the world, right? That is, as much as you can attract talent, as much as you can close those open recs and place talent in your organization, you're just always going to need more. Healthcare is a beast that has to be fed, and I don't see those demographics really evening out for a really long time in the future, right? Longer than we're going to be talking about this dilemma.
Yeah, and the thing I might add to that is that the issue with physicians is, this has not snuck up on us. We know for some time the aging that's occurring within the physician workforce. And the nurse workforce as well. So some of this is due to just reaching points in life and in career where there's a little lower rate of tolerance, and I'm ready to move on and ready to do things. So there's some of that dynamic. But the thing that I would want to point out is that in both physician and nurse situations, I think the opportunity is there to still modernize organizations' approach to the work environment. That's one of the things that has not happened. We mentioned safety a few minutes ago, but we just finished our Inside Employees' Minds research, which we do annually of healthcare workers all across the country. And it's not about what are your benefit preferences. And it's like, what are you worried about? What concerns you? What bothers you about where you are? What do you like about where you are? What's important to understand? And what we saw between this year and last year was a very significant drop in some key areas around, can my career goals be met? Do I recommend this to my family and friends, this place to work? Do I feel like my skills are rewarded and this is a place where I want to spend my time? A significant drop to us is a drop of 6 or 7 points from where you were the previous year. On some of those, we've seen drops of 11, 12, 16 points. So very dramatic. There is a different thing happening in terms of how people look at the work and the people they work with and for. And organizations can be doing more to think about the design of work, the safety of the environment, taking out some of the noise and the chaos. Again, this is all data-driven, but there are opportunities to improve what and how doctors work and work together and what nurses do. It's time. I mean, one of the heartbreaking things is we spend a lot of time with physicians, interviewing physicians. What do you think? Where are you? The notion of pajama time is something that it took me a while to get my arms around. But pajama time, by the way, is when you have a full day of seeing patients, hands-on, care either at the bedside or you're in a physician practice. And then when you get home at night, get dinner, visit with the family, and then before you go to bed, you have 3 or 4 hours of medical record work to input. And it's an incredibly long day. And then you're up the next day doing the same thing. Now, I'm oversimplifying this a little bit, but the things that can be done must be done in terms of how we simplify the work, how we support the work. And Will, tell me if I've got a better word that we should be using, but modernize is the way that I would phrase this, that we think about task level work redesign of physicians across and down to support. We're doing a lot of that with clients now and seeing a couple things happen, Vince. Number one, the job becomes much more manageable and satisfying, but we're seeing 30 and 40% increases in capacity. So get of a workforce or of a job, and talk about something that's desperately needed as there's workforce shortages, as there's turnover, as there's burnout. Got to find ways to expand and improve capacity and the work. And we can do it. It's just a question of get the data, follow the path. It's doable. Organizations are doing it all over.
So now I'm speaking as a recruiter, and I don't recruit in the healthcare world. So please understand, this isn't for my own personal, it's for our audience. What specifically, if you can, let's take the doctors first, what specific characteristics should recruiters keep their eyes open for talent, not just random doctors? Because nowadays everybody specializes in, you've got your generalists all the way down to your specialties. But in your eyes of looking forward, if I was recruiting in the healthcare field, what should I be looking for that's going to add value tomorrow more than it was yesterday?
I'm going to throw out a few words. I know Will will want to add a few more, but I would start with resilience and agility in terms of acceptance of where the world is today and what changes may be coming or are coming and how individuals react to that. I think that a couple of the medical schools that I've had the pleasure of getting really close to have changed very significantly how they train physicians, much more team-oriented, much more accepting of different levels and appreciation of a team. Historically, the medical doctor training was very much, this is all about you. It's on your shoulders. You make the decisions. This is all you. And again, I'm exaggerating that a little bit, but the shift and then the way that the students react to it is just really exhilarating. So we've got a lot of negative things we've talked about and we'll still talk about, but there's some good things happening in the way physicians are being trained and developed, the team orientation. This is the best thing that can be happening to them. And I think that, among the best things that can be happening to them and this work environment is to have that kind of team and team support and approach. But some of the, doctors that came out years and years ago have a little different orientation and some struggle with that, but we're getting there. Will, what would you add?
Yeah, I mean, I think the reality in the numbers is that depending what you're recruiting on in the physician space, you might not have a lot of room to be super selective on additional characteristics, right? I mean, when we're talking about, for a lot of geographies, roles like primary care physicians, OBGYNs, pediatrics, there are meaningful shortages, which means that as a recruiter, if you can find somebody who meets the qualifications, that might be the end of the conversation. But I do think, what John said is really important, that we're seeing a bit of a generational change in healthcare, both in terms of the actual generations on the ground, but also this larger sense of modernization. And how can we bring in new ways of doing things, new ways of relating to each other, new ways of relating to the patient, new ways of using technology. And so probably the number one skill beyond actual medical patient care skill that we're seeing pay off in hospitals from physicians is the ability to be a team player, right? To be able to just show up and work with other people in other roles. Medical care, patient care, it's a team sport. And when you see that work really, really well in hospitals these days, it does feel seamless, the handoffs between different roles and different members. I think the other thing that a lot of, especially hospitals are struggling with today is, what does it look like to add more and more technology, and especially AI, to how people execute their jobs? And we have people who are more and less comfortable with that transformation, right? And so, I think as a recruiter, one of the things that you should be listening for and looking for evidence around is, how adaptable are these people? Because medicine has always changed pretty quickly, but the practice of medicine is now changing at a more accelerated clip than we saw in the past. And that ability to rethink who you are professionally and how do you show up every day and how do you connect with other people on these teams, that is now changing in a very regular, predictable cadence that wasn't necessarily like that before.
So let's flip this to the nurse side, and forgive me. I always feel that nurses are treated almost lesser than doctors in a lot of ways. And I'm kind of appalled at that, because the true patient initial contact and connection starts with the nurse. And boy, if you've got good nurses, the doctor actually has a bit of a head start in dealing with the patient, in my eyes. Again, the only thing I know is as a patient, but it's pretty relevant. So, same question as a recruiter. Some of what you said about adaptability and ability to work with, that's got to be a major key with nursing. But that role had to have changed tremendously too. What's going on in the nursing world, gentlemen?
Well, I think the nursing role has actually changed even more than the physician role over time. I mean, if you step back and look at the last couple of decades in medicine, from a bigger point of view, one of the defining trends is more role differentiation happening within these teams. So the world isn't just doctors and nurses anymore, right? I mean, there's so many flavors and adjacent roles that kind of come together to support the world. Nurse practitioners, physician assistants, nurse assistants, medical assistants. Like it gets so granular in a lot of clinical environments that, it sometimes feels like everybody you interact with has a different role, a different title, a different set of training. I think that being said, nurses for a lot of hospital systems are still the backbone of the system, right? The people, I mean, sometimes I joke that they're treated like Swiss Army knives, that you can flex a nurse up, you could flex a nurse down. Like they're often used to make sure that the entire system runs really smoothly. And I actually think one of the challenges that a lot of systems face these days is figuring out how to best use nurses, because I think all of our goal, and you hear clinicians say this all the time, the goal is to let people operate at the top of their license, right? And so when you ask a nurse like what they want to do day to day, how they want to spend their time, how they want to use their talents, the things they talk about are really at the top of that nursing license. But in order to have that happen, you have to think about the entire composition of the medical care team, the patient care team, and making sure that you have enough support functions in there who can come in and take care of things at the bottom of the nursing license to free up capacity for nurses, to keep the economics of the hospital system in check, right? And to make sure that people are doing the thing that they could do to most drive productivity for the organization. And that's not what we see in a lot of systems. Instead, we see people running into each other, right? Doing not just their job, but somebody else's job too, keeping somebody else from doing their job when they could do it more productively. And I think that's, when we think about what type of responsibility healthcare employers have to their nurses, I think that's the top responsibility. How do you make sure that when you hire a nurse, you are allowing her to do her job to the best of her ability at the top of her license? And I just think that's huge.
Yeah, let me add to that, because I think you have to understand the foundation or the roles below the nurse. And some of these are lower paid and they're harder to keep. They're lower skilled, they're lower paid. It's a giant challenge in healthcare is how do we keep these people there at minimum wage working in this environment as opposed to, going to work for Buc-ee's or other places that'll pay them as much or more. But you want a happy nurse, that nurse has got a solid infrastructure below him or her that is patient-focused, doing a good job, handling all of the support that's necessary. When that breaks down, who does that stuff? The nurse. Do they like it? Not typically. Do they want to go to top of license, as Will was describing? Absolutely. So to keep your eye on that ball is absolutely critical. But the other point I want to make also when it comes to nurses especially is this notion of flexibility. We just finished a very interesting pilot with a large academic health system in the Southeast, and everybody knows them. And what we did was took a nursing unit, a group of nurses, and started modernizing the approach to staffing. And this is a group of nurses that were able to work at the bedside, super intense environment, 3 days a week. 2 days a week, we were able to adjust their jobs so they could do telemedicine or support remotely from home. The engagement for this group of nurses went up. You ready, Vince? 90%. The turnover for this group of nurses that was high went down 60%. Now, is that going to happen everywhere? Certainly not. The reason why we did the pilot, and we're going to talk about pilots, I hope, Will, because your world of AI has absolutely changed how we pilot stuff. But just to finish this point out is really the we knew it was going to be impactful. We didn't know it'd be this impactful. So I think the notion of give these folks a break, let them have some input into how the staffing model could work, or at least experiment, try to find ways to give them relief, and the quality and the patient satisfaction scores, everything will likely go up. But it's got to be thinking differently. The saddest line I hear in healthcare today, and I still hear it more than I want, is, well, we've always done it this way. And that's just not that dog's not gonna hunt anymore. We've got to find new ways, breakthrough. And again, my caution here is data-driven. Make sure that there's data and it's predictive and you're doing what you can to leverage every bit of it. And Will, that's a nice thing.
So before we go into the pilots program, you brought up the telehealth. I'm struggling with telehealth being as effective as person-person. Because I go back to, look, I'm a boomer. and the doctor grabs my knee if my knee hurts and twists it and bends it. And the nurse, does some of that stuff too. How can we do that with telehealth?
Well, it's not replacing the hands-on or the face-to-face, but it's become, and it will grow, and it will be an important component of every healthcare delivery system that we're talking about. There's got to be some component. Talk to people that live 200 miles from a provider, or just what I did with shooting a picture of a mole on my arm that I didn't like to my dermatologist, trying to get an appointment with her, forget it. But I got a response immediately, like, fortunately, no problem. So there's a combination, Vince. Again, I'm going back to that word modernize. It's part of where we are because it can be. And I think that really enables a lot. But again, this was an example I throw out there just from a standpoint of giving some flexibility for where and what and how people do their work and approach it.
Well, I think that's what stood out in the example you just used, John, to me, is that I think we're all used to the idea of telemedicine, right? Like it, hate it, it's going to be part of the medical sort of practice going forward. It's part of the playbook. But what you just said, which I haven't heard a lot of with healthcare providers, is that rather than hiring a separate staff of nurses that were remote or virtual or leaning into telehealth, you were talking about creating roles where the same person could one day be physically in a hospital at the bedside, working in the physical real world with the patient, and then the next day might be working from home, virtually contributing nursing skills within a hospital system. So suddenly you've just taken a role that I think for a lot of people was exempt from any discussion of flexibility, remote working, work from home. And you've suddenly made it possible for this person to have like a hybrid in-person remote work lifestyle as though they were, any other kind of like office-based professional. And to me, that's a game changer. Like that's something that they could make a real difference.
Both those roles, just to be fully transparent, required task level redesign to make that work because they didn't have the telehealth thing all ready to go. Just plug it in. No, it didn't work that way. We had to do task level. What can be moved? What works? How do we want to But it was doable. It took 4 days to do task level redesign of these jobs. It was not 4 months. And the pilot was 6 months. Now they've expanded it. It doesn't fit everywhere, but it's informed a lot more innovation and approaches. And the nursing leadership is saying, whoa, maybe we don't have to do it the way we always have.
So, Will, why don't you give us a snapshot of the pilot program?
Oh, so I think, what John was talking about and I think this is one of the things I'm probably most excited about in healthcare right now is that healthcare has always been at the not just cutting edge, bleeding edge of thinking about data science and AI and new methodologies. But a lot of that energy historically has gone to the clinical side, right? Like how do we use AI algorithms to assist radiologists in identifying, test results that might indicate cancer or something else, right? Or how do we create tools that allow a physician to spend less time on their case notes and be able to, talk or ambient recording? Not a lot of that energy historically has gone into the HR side of things, right? People, like how we think about hiring and staffing and creating an employee experience and keeping and retaining people over time. And that's something that I am seeing just booming at the moment, right? Our ability to take some of this data science and AI capabilities that are applied in other environments and bring it into the hospital to like affect how work is actually done. So one of the things that I know my team works with a lot of healthcare clients on is thinking about how we can take all of these many, many pilots that every hospital is running at any given point and actually, before you touch a human being with a pilot or an experiment, be able to digitally test it. And so we're running a lot of digital pilots where we're using algorithms to create digital twins of people who are on the ground, and we're able to simulate what might happen if any factor in the organization were to change, and really do that very, very fast. So in the time that you would do a normal pilot that everybody's become accustomed with, you might be able to run hundreds, if not thousands, of digital pilots. outcomes. And it changes the mindset entirely. Like it's no longer how do we come up with a dozen ideas and put them all into pilot form, and maybe one of them ever moves on to like a phase 2 pilot, right? If that. Now it becomes more of a mindset of, before you ask for a pilot with human beings, you've got to be darn sure that that's going to work. And then the pilot is more about confirming. And the expectation is that almost anything we pilot is going to be rolled out at the end of the pilot to a larger audience. I mean, that is a game changer in the world of medicine. It lets us constantly and nimbly be testing and learning and moving to what's going to be more futuristic. So I know John's passionate about this. I've seen the results on the ground. I think it's probably one of the things I'm most excited about in the healthcare space.
And so are our clients. I mean, the HR folks they can say, hey, to the board of their hospitals or senior leadership, yeah, we're doing AI. Look at this. We've modeled. We've got digital twins, and it's lit the whole thing up, Vince. It's been fabulous.
So to bring this to a close, I have one question, and we'll start with you, John, and end with you, Will. We have an audience of recruiters, healthcare providers, patients, people who do what you do. What message would you like to get out to our audience today from you? John?
Okay, this is going to be fun, and I'm going to keep this message tight, I hope. The thing about healthcare that I find most important for everybody to understand is that the solutions that we need to address these incredible problems that are so persistent and will be here for a long time unless we change, but are here for the present and the near future. And again, to reference a study Will mentioned, when we talked about organizations need to take 20% out of their operating expense, the rest of that sentence is, or not remain viable. So, I mean, the stakes are incredibly high for healthcare providers. So my message on this is data, data, data. There is more of it in healthcare than any other industry. Every single thing that happens to an individual from the second they are touched or enter into any kind of healthcare provider environment is tracked. And we have the ability to leverage that, to predict, to give organizations both the baseline and the direction and the ability to model, as we were just talking about, because the solutions are there. They are not out of reach. They're not impossible, and they're not things that we can't afford. They are absolutely doable. So that's my message. Data, it's all doable.
What a great segue to Will.
I know. I'm so glad John mentioned data, because he gave me permission to geek out a bit. I mean, I am a data scientist who works in the HR space. So my lens to the world is kind of inherently data first. And when I think about the challenges that we're seeing in the recruiting space, especially in healthcare, I think there is a data-driven answer that very few recruiters were ever kind of trained in or, kind of taught how to use moving up, but it is going to be make or break for these systems moving forward. I mean, we have, system level shortages in almost all healthcare roles as we're moving forward, which means that it's not just about being a better recruiter, being more persistent, or sourcing more, leads. It really requires rethinking the entire approach to talent acquisition in a way that wasn't necessary in the past. So I think about things, for example, like what retention looks like strategically for a healthcare system, and it can't just be paying people more, right? We've done that. We've gone on that roller coaster over the last few years. Wage inflation in healthcare is outpacing certainly just general inflation, but even just wage inflation across industries. And we've hit a point of diminishing returns. Like paying more is not going to keep nurses in your hospital, which means that we have to think about something else. What will keep them there if it's not going to be money? And I think data is the answer. Like rather than going out there and, testing and learning your way into what matters, again, everybody's leaving digital breadcrumbs through everything that they do, especially in healthcare. And so there's the opportunity to really lean into data science to understand, without even necessarily talking to people directly, like what matters, what's going to keep them to stay, what's going to actually affect your turnover rates in the long run. So much easier to keep somebody than replace them. But even when you think about the replacing side, and we actually want to like leverage and send out our armies of recruiters to do their job, giving them more of an understanding of what they're looking for and having that be really data driven and persona based. I often ask clients, what does success look like from a recruiting standpoint? And they usually say, somebody signs the contract. Maybe they go so far as to say, and they show up on the first day of work, right? But really, we should be more ambitious than that. We should be thinking, who's still there 5 years later and is being rated a top employee and has good patient outcome results? And then how do we reverse engineer those people? Like take your superstars, the ones who really are a positive outcome, and let's figure out where they came from, right? Like how could we have predicted 5 years before that they were going to be great? And then how do we apply that learning to everyone that we're screening through the system so that we can create smarter talent acquisition systems that are really building those talent pipelines for the future? Wouldn't be possible in all industries, but in healthcare, because again, everything is so data driven, everything you do moving through a clinical setting is recorded. There's just this wealth of data that can be mined and leveraged and treated in a more sophisticated way. And I think it gives us options on the front end that you wouldn't necessarily have everywhere else.
Well, gentlemen, I want to thank you very, very much. You've opened my eyes to a lot, but more importantly, I think you guys have a grasp of where you're going and how to get there. To your words, it's going to take some time. And I want to thank you both for taking the time today and spending it with me. And I know our audience is going to be excited to see what the next stage is. Thank you both.
Thank you for having us.